waiting for it to say record. So we're done. Thanks everyone for coming to the Aging in Place Financial and Legal Barriers Subgroup. I'm Julie Devlin, one of the co-chairs along with Representative Krista Griffith, and I am the Executive Assistant to the Director at the Division of Services for Aging and Adults with Physical Disabilities. Let's go around and do introductions and then we'll get down to the agenda. So Representative Griffith.
Hi, good morning, Krista Griffith. I'm co-chair with Julie on this committee, and good morning. Nice to see everybody again.
Okay, Lisa Zimmerman. It comes up. Lisa. And we'll try to come back around to Lisa. Denise.
Can you hear me? Can you hear me now?
We can hear you, Lisa.
Okay, I had to hit *6. I was double muted. So good morning. This is Lisa Zimmerman. I'm the Medicaid Deputy Director, and it is a pleasure to be with all of you this morning.
And now Denise.
Robinson. I'm a nurse supervisor with the Division of Medicaid and Medical Assistance.
Jerry.
Jerry Councilman, retired resident in North Wilmington, community volunteer.
Great. Kylie.
Good morning, Catherine Reed. I go by Kylie, Estate and Elder Law Services, Elder Law Attorney.
Jamie.
Hi, good morning. I'm Jamie Ramage. I'm the owner of Comfort Keepers in Delaware, and I sit as the president on the board for the Delaware Association for Home and Community Care, otherwise known as DOC.
Great. Robin.
Hi, my name's Robin Mooney. I own Carpe Vita Home Care. We service Newcastle and Kent County in Delaware, and I also sit on the board of DOC.
Great, thank you. And we have Mike Sheridan, who is supporting us from the legislative staff. So thank you, Mike. And then also the great DTI team. So thank you for all of your technology help for this. So we'll go ahead and get started. Did everybody have a chance to review the minutes?
I think that's my fault. Julie, I don't think I sent, Mike sent them to me to review, and I don't think that we were able to send them out to everybody. So we'll send them out. Is that correct, Mike? I think we need to get them out to the committee, and then we can put them on to next meeting's agenda. That's okay.
Yes, that's correct.
Okay, yeah, that was my fault too then, because I didn't say anything. Okay, so we'll get that out to everybody, and then we'll review them at our most likely last meeting of this subgroup. So if you all attended or listened in to the full Aging in Place work group, that work group is tying up all the different loose ends from all the different subcommittees and should finish all of the completed work with recommendations by the end of next month. And so our job for this subgroup is to come up with our list of formal recommendations. So we've done a lot of talking about different things that we could recommend, a lot of fact finding from different programs around the country, as well as learning more about adult protective services here in Delaware. Now we have to kind of put forth formal recommendations. And so, Jerry, I don't want to put you on the spot, but you sent Representative Griffith and I a great email with something that could be a recommendation if this group would like. And so if you wouldn't mind talking about it, that would be great.
Well, since you share that it's great, I don't mind. During these sessions, I've been coming back to primary care as we've spoken about how we can reach out to seniors and get the information out there. And I think at the last meeting, I mentioned that I would be having my annual physical, and I did. And my primary care doctor is Dr. Zarek at Progressive Health here in North Wilmington. And as I looked around the room, I asked her how she would feel about a poster indicating some of the information that we've discussed, and she thought that that was fabulous. Then Dr. Donahue manages the office for Progressive Health, and I've been sending him the minutes from these meetings and discussing it with him. And he asked me, he said that the practice was considering hiring a social worker. And did I think that that would assist in some of the outcomes that he identified in the email that I sent you. And I said, certainly. He's doing a number of initiatives. He has been for the last 4 years for people in my population and older. And so I asked him if this group had a recommendation to do a pilot project in any of the areas that we discussed, not just social work. Might his practice be interested in participating in that? And he didn't say yes, but the title of I've known them since they've started practicing, maybe 22 years. And they're titled Progressive Health for a reason. They are always doing new things. And so he said, if this group decides to identify that as an area that it would like to recommend, that he would be interested in hearing more.
Great. I do know that I think when Olga was on from Classy, she mentioned they have a medical partnership with Classy. So we could expand that. I know that our state agency, DSAP at the Division of Services for Aging and Adults with Physical Disabilities, has an elder law program with Classy. And so it's a nice tie-in, and that serves everybody no matter income as well.
Classy, the acronym, sometimes I lose the acronym.
It's Community Legal Aid Society Incorporated. So, and they have offices throughout the state, but they provide, the elder law program specifically provides legal services, including advanced care planning. They do a lot of powers of attorney for people 60 and older.
No, I did send him the document that Catherine, I'm reading Catherine, so I know that you mentioned a different person, but the population that Progressive Health serves, in part, that listing that Catherine gave us would actually meet that different population that we've been talking about, people who actually have some resources. But I think within the bullets that Catherine mentioned, they're not expending their resources. So you would think that they would know how to do that, but they're actually showing up, needing things that the systems currently are not capturing or meeting, or they're not accessing. And so many of the people, Dr. Donahue is running monthly workshops around mental health, a number of things. And I know from participating in those that there's a high percentage of people who are following, and they do have some resources to bring to the discussion, but they're not expending anything. They're just kind of frozen.
Representative Griffith?
Thank you very much. I like the idea of a pilot project. What are some of the, if we could just zero in on that, in terms of the legal and financial barriers, what are some of, I think that you had the idea, Jerry, of like you said, I think the first thing you mentioned was like a poster with, critical information there about how to access information about, I would probably be, how to plan for, anything from like what the services available that Adult Protective Services are not the DSAP it offers, preparing for your wills, all of that, life plans, et cetera. Like what information, if we could go around, if we had to devise a poster or some informational material on the issue of legal and financial, what I'd like to hear from everybody about what we would put on that. And a posters, I mean, it could be a handout, it could be any information, it doesn't have to be, it could be on a website. We don't need to be restricted in terms of the format that it will be in, but just that we will be delivering information to the public. What specifically, what would be the top things if we could go around, everybody ask, what would they put on there? What were the critical issues that they would put on?
Kylie?
Get a financial power of attorney in place before you lose capacity, or else guardianship will be needed, which is expensive and time consuming.
Yeah, that is something that is on my physical form. but it's not discussed. And when I've asked questions, the physician bridging that discussion, Kylie, it's on the form, but so the way you would state it would help the medical staff. And I mentioned the poster again, because I sat there for 12 minutes, so I'm a captive audience, and I'm not on my computer when I'm alone in my gown. So I remember someone in the group mentioned like a bulletin board on this highway. And, I would go by that very quickly, even if I'm going in the speed limit. But sitting there in the waiting room, I had 12 minutes to look around. And so it is good to have a handout, and they do have a whole table of handouts, and I do take them occasionally, but it's not interactive. And so the hope would be, like they do have things on their office wall, and usually in that 12 minutes that I'm waiting, they're very focused on nutrition. And so I pick up a few things from their very creative brochures, posters on the walls, and then I'll have a conversation with Dr. Zarek, and I'm able to touch the poster and ask her about it. So when I think of my special education background, I'm thinking of a senior that maybe doesn't have as good communication skills, because we've often talked about we can put things on computers, but we are not necessarily talking about a population that either can, this population at Progressive could afford computers, but they're not very savvy with them necessarily. And so I have to get out of my mind head because I'm very good with computers, but there's a whole bunch of people, and especially the staff. The nursing assistants might not be opening up a computer, but they will engage with something more physical in the room. So we're talking about making it accessible.
Kylie, did you have additional comment?
I did. This is brief. We have to be careful to not have the doctor giving legal advice. And we have to be careful to not have people doing it yourself, going online, finding a form and filling it out. A major problem that we have from basically do-it-yourselfers is they don't understand the extraordinary powers that, on the statutory form. And so they'll come to us, for some things that require those extraordinary powers, and they've not been checked. So notwithstanding that they have a valid power of attorney, it's inadequate for the things they come to us for. So I don't have a solution for this. It's very self-serving for me to say, see an elder law attorney for this, but it's honestly the truth. They need to see somebody who can counsel them on the different powers and why they may need them. A practical thing that they need counseling on is the dangers of having co-agents. A lot of people do that. They appoint their two kids as co-agents under their power of attorney. Well, that's a mess. You're better off with one and then a backup. And it's been well documented in the literature. So maybe, Julie, that's where your group is. Maybe you take Jerry's great idea about the poster, which really is a great idea, but there's some kind of connecting. You got to make the message, you need to do this, and then you need to tell people how to do it.
Yeah.
Where to go to get it.
When I think of a pilot, I also think of what Dr. Norman is doing in the libraries, which is creating space for professionals to be within the libraries where people can access, because many of our libraries are on bus systems, and they're creating private spaces. And I can say at this medical professional office, they have people who are not on their staff who are consultants. So I don't know if he'd be hiring a full-time social worker on his staff or having a consultant and creating space within their physical environment. So there are those kinds of options. I don't think the medical staff would be wanting to give legal advice. I think that's kind of why they just go blank when I ask them questions. That's appropriate. But then I'm like, what do I do next? So we could pilot with me.
Yeah, I know that like in New York, they had a pilot program that was very successful, putting attorneys in doctors' offices. It was for low-income individuals, but we could make it whatever we want because it's one less place that someone coming into the doctor's office when they don't have time to, it's one last thing that they have to do. They meet with the doctor. If they need a POA or something, another legal need, they go down the hallway and meet with the attorney that's right there. So.
And then there's also the trust factor. When you're at your doctor's office, if I have met with legal professionals, now I haven't gone through the full scope, but if there was someone in my doctor's office that Dr. Donahue was pre-screening and felt comfortable, I would have a tendency to open up a bit more around those. I've avoided doing it, so I'm not alone. It's a big thing to have those discussions.
Representative Griffith?
No, I appreciate what Jerry's saying about being a captive audience, because I think we've all had that experience where we're just like trapped in that room and we just dying to look at anything. And so there's an opportunity there. And I think that we could craft something general enough that would point people to where they can access resources without getting into the realm of legal advice. People, and we're going to, general information is helpful anyway, because you're hitting a lot of people with different income strata, some who won't be able to afford an attorney, and those who may have never heard of Class C's assistance for seniors. So, I mean, I think that, that could be important. And also, I think that's on that legal piece, but the other part that we're here for is the financial barriers. So again, reminding that kind of information can be used to explain to folks what's available to them in terms of consultation with the SAPIT and the resources that are out there for all income levels to start planning. The idea is to give everyone a central place to go to where they can get information without having to spend a lot of time. And chances are, if they're even sitting in the doctor's waiting room, they may have a neighbor or a friend that's needing that help. And so it may not even be for them, but they're seeing that and that's triggering them to go share that information with other people. And yeah, I like that idea, that pilot project in New York. I think we need to know more in terms of what that would involve, but it's great. Like, that's great thinking. Like, I think the community, again, we got to really make sure we do better as a state to communicate what we have and then build upon that.
So we'll add that our division is working on an outreach campaign targeting caregivers. And so we just had our first conversation on Friday with the marketing team, but it's identifying if you're a caregiver or not, and then pointing them to resources. So we will be doing, posters and things like that. And that's definitely something that we can put in a doctor's office, because caregivers bring their loved ones to doctor's offices, and they might not realize that they're a caregiver. So, and we're really focused on respite for that, but there will be a way. We are pointing them to our Aging and Disability Resource Center, which is the one-stop shop, online and through a phone number. We're redoing our ADRC website as we speak to make it connected to 211, so it has much more visibility and accessibility. So, the state is doing things. We also point them to Lisa and her division at DMMA, and we're working closely with them to make sure that people who can be on Medicaid services are on Medicaid services, because there's a plethora of opportunities through Medicaid that our division doesn't offer. So we are working on that, but we definitely, I love the poster idea. I think it's a great idea. So Jamie?
Thank you. Yeah, I just wanted to chime in terms of the poster. I don't want it to, I don't think it should be too much, but I also think it should cover the phone number for people who don't do websites. But I also think it also has to cover like a QR code for the younger caregivers who can do the Zap, right? And then take them to a website. So we've got to cover all angles, because you don't know, to Krista's point, is it really the client or is it the granddaughter? Everybody has their different touch points. But Julie, I would love to just be able to send someone to the ADRC, right? And I'd like to have one phone number, one website, one place to go. I will just say though, too, when I don't know that they have the most recent, latest, greatest information, and especially 211. When you bring, I will still get phone calls to my office that 211 pointed them my direction, and it's not accurate. Ideally we do have a one-stop shop, but that needs to be the most accurate and complete information as possible.
Yeah, I agree with you. I think that was part of our problem with our ADRC site. If you look at it right now, it's pretty stuffy. It's very hard to navigate. It is not updated. And so part of our revamping and working with 211 is hiring somebody that will work for 211 who is an expert in aging and disability resources. And their full-time job is to do outreach with organizations to make sure the information is updated on that site. So that is, the long-term goal. We've already budgeted for it, so I can tell you it's definitely happening. It's just we're not there yet, but we know that that is an issue. We want to make sure that people who use online, which we're finding are more and more people, get the services that they need, and they don't necessarily have to come in through, DSAPIT's door. They can go through multiple doors to get the services. Anybody have anything else that they would want to see on the poster? Yes, Kylie.
To Jamie's point on hitting all the points, she's talking about hitting all the technology points. Maybe you make a point to hit all of the substantive points. There's the legal barriers, there's the financial barriers, there's the caregiver abuse. There's the abuse concept, there's the legal concept, which is the power of attorney. There's the financial concept, which is, that has multiple components. How do you pay for care? Power of attorney is better than a joint account. I mean, you can't say that on a poster because there might be some rare instance, I don't know. You can't paint with too broad of a brush. But my point is, somebody before the poster is made, effort should be given to keep it simple, but to capture the top 3, 4, maybe 5 headings.
I think getting it friendly and engaging so that people feel the warmth. I mean, when I called Adult Protective, it was the warmth of the receptionist on the line that I'd lean forward and ask more questions. And I think the poster, engaging that. Also, it's going to be the medical assistant who comes into the office and fills out all the questions with the person, getting them to, so I don't think you want to overwhelm it with information, but you want to get people a little bit, and I think then going to the website, or one of the representatives in one of the other groups is talking about a recommendation for some kind of management core. I think there's another program in the state where there's some kind of facilitator, and I can't think of I'm hesitant to say, I just know that there's a big discussion on another recommendation for a coordinating feature. And I don't know how big she's thinking that would be. But I think getting a poster that it can be off-putting if there's too much information on it. It can overwhelm a person. And that's a lot of what's going on now. You kind of tune it out. It's overwhelming. The idea is to get people reaching out into the right location, in my mind.
Jamie?
I would just say, I think Medicaid waiver is such a big component because it touches people that both do and do not have resources, but it's such a complicated process to know where to start and how to get through it. So that would be a big one that I would like to see. I think it touches both the legal and financial components.
Yeah, I've been thinking through all of these comments that we have to pair the information and outreach that we're doing with training of professionals as well. So, you know, if that medical assistant is coming in the room and someone has a question and says, what is this all about? You know, they'll have some kind of answer and familiarity with it. And so, you know, our division, Medicaid, we need to work with our medical providers who are seeing, you know, everyone and do a better job around what kind of services we offer from the state perspective.
I did mention in my first session that I get a monthly questionnaire that's paid for by my retired insurance. I guess it's Medicare, because I'm not very up to speed how the funding works on that. And so there's a nurse assistant that calls me monthly. How are you doing on your meds? Do you have any needs? And I would say, and that's something that the provider offers me, not everybody signs up for it, but I have a relationship over the phone once a month. And I know that people who have more needs in the practice who are elderly get calls more frequently. And that is actually a billable service that the provider gets paid for. And when you're talking about the staffing, I know that the person who calls me could use some skill development, definitely. And that's a strong contact point for patients.
And I also had another thought. I know, Joe, you were saying that the poster needs to be friendly, and we're working on throughout the department, just being healthy and like healthier you. And so from our division, we're focused on age-friendly efforts. And that includes the language that we as a division use and our partners use and what that looks like, because aging is about vibrancy. It's not about vulnerabilities. And so definitely, I think that needs to translate into the poster.
Are you going to be doing a public service visual kind of announcement or any marketing along those lines?
We're hoping to. So we started doing some of that work around the pandemic and the vaccine work that we've been doing and targeting people with disabilities and those who are aging to get the vaccine and make sure that they get their booster as well. And so as the department moves into this new phase of the pandemic and talking about healthier you, we will be moving into age friendly. So we're as a division looking at the services that we offer and looking at services more upstream and working with organizations like the YMCA and things like that to really talk about aging as a positive thing. I think a lot of people come to us at very difficult times when they have already they're at their lowest point, and we don't want that to happen. We want people to come to us when they turn 60 and they just want services to continue living in their home and their community, and we want to provide those services to them.
And as Kylie had mentioned, when they're younger, they really don't or tend to think about wills or moving in that direction. And
right.
So
and
sending that message.
Yeah, I definitely, I mean, from my perspective, legal services should be like upfront, like just part of what you do. If you're looking to move out of your home into a smaller home, you also look at your legal options at that point. And it's just like part of the work that you do as you're aging. And it's not a negative thing. It's just protecting you and your family for the future. And so how we talk about it, what Kylie was saying, and obviously I don't know how in a poster, I'm not a marketing genius, but in a poster, how we talk about it is something, I think is going to be important, because a lot of people do think that the legal piece is scary. They don't realize the financial toll aging has, especially as people get later in life. If you have dementia, the kind of financial toll is astronomical and what that entails. And so we have to be realistic, but still be friendly.
Yeah.
Denise, Lisa, Robin, do you have any comments that you'd like to add to the discussion? No.
No, but the dog in the back definitely has some things to say.
I'm so sorry that my dog is barking.
I love it.
Yeah, I apologize. He has a on him.
I love it too.
I don't have anything to add. I think they are just all very good ideas.
One of the other ideas that has come up in a lot of the subgroups, which I think might fit nicely as well to talk about with this, is having community navigators. Yeah, that's it. That's right. Yeah. So having community navigators in different, and I'm not sure what it would look like. I haven't seen the official recommendations, but having people throughout the community that can help people, for lack of a better word, navigate all the different resources out there. So my organization, Lisa's, our sister agencies, the nonprofit community, really just the whole aging network, because it is complicated. I think we all know that. So that's something that if our committee wants to sign on to, we can do that as well. Representative Griffith?
Thanks, Julie. I love that idea of the community navigators. And I think we need to really think some ways out of the box on this, and that they're not necessarily, community navigators. We can do outreach to include all sorts of people, not those folks that you normally are your go-tos that are work for state agencies or senior centers, but maybe we reach out to those like organizations that represent large civic organizations. Every area has one. There's there's the CCOBH in North Wilmington. There's the Greater Hockessin Area Development Association in Hockessin. There's multiple organizations and groups that represent large groups that represent smaller entities, where you might find, if a presentation is given at these meetings, these homeowners associations might take that information back with them and say, hey, is there somebody here in our neighborhood that wants to be sort of the point person for resources for aging, and that they, that person's name is given to the community as a resource, and that person goes through some sort of training program with DHSS, so that it's not just they're just shooting at the hip with the information, but they've gone through something, not extensive, but an hour or two training on how to guide people properly to the appropriate resources. Anyway, I think that's sort of, I remember Kylie long ago saying, we always try to come up with strategies once the cat's out of the bag, in terms of financial, someone's stealing from seniors, but then, it's too late. We really need to start paring down and be like, what's our starting point, rather than get to the point where someone has been, someone's taken advantage of a senior, et cetera, and then it's too late for them. So I think that might help.
It's really interesting to me because I just joined the board of CCOBH, and with the purpose of, they used to reach out to civic organizations, and recently they haven't been as strong in that area because they have so much else on their plate and it's all volunteer. And I'm coordinating meetings for the civic groups that are members around streams and trees. But this would definitely, they do cover the gamut, and it would be a large audience.
Jamie?
Low key.
I'm sorry. Go ahead, Jerry. I'm sorry.
It would be low key, and our representatives are at those meetings. They're invited. And so when they are talking to constituents, so when Councilman Carter comes to my community, he hears everything. And so it's a lower, less threatening location to discuss some things in your local community with your fellow residents, and it builds community.
Great. Jamie?
I was just going to piggyback on what Krista said and Jerry, from the standpoint of I'm thinking of DOC, our association. So it's an association that represents home care, hospice, and there are other members such as AmeriHealth Caritas and Highmark Health Options. So the associations that are out there, it's not every home care agency is a part of DOC, but it's a majority of us, right? And it's a good place to go that we could help others and we could be that steward. Yeah. So if we could reach out to associations, I think that would be great.
Yeah, there's a really great model that the substance use disorder community is using. So our sister agency, DSAM, is working with the lieutenant governor on where they take trusted people from the community to work with individuals who have substance use disorder to connect them to the resources that they need. And we could use the same model with people who are aging to help them age in place. Have trusted members of the community. Civic association is a great example of that, where they already know the people, they know their faces, and trust them with the information that they're providing.
Yeah.
Yeah, that sounds great. To be able to leverage, what did you say? It's through DSAM?
Yeah, it's through, it's the model's through DSAM, and it's a fantastic model. I mean, there's a lot of other in the community where, trusted people work. We used it for vaccine outreach as well, where we found trusted individuals to get out the word in faith-based communities and cultural communities and things like that. So people listen to people they know. Obviously, we all know that. And so if we can leverage that, that would be great. Representative Griffith? Oh, go ahead. I'm sorry.
I know that Christiana Cancer Center has done that. Triple negative breast cancer is the largest in Delaware, and it affects minority individuals the most. And they have a large program of outreaching to meet the needs. It's probably 3 years old.
Representative Griffith? You're on mute.
There we go. Yeah, I think we're really coming up with some great ideas, and I think we could even start pick a homeowners association, like among the things we do, like for a pilot, for test it out for a year, like pick 3 larger civic organizations in each county, and then see how it works and see how successful it is and how engaged those civic associations become. And then we could get some real life stories about how impactful it is.
The other thing, I'm involved with the Delaware Library Association's Social Justice Committee, and that covers everything. And it's a group of dedicated librarians. And it's only about 3 years old, but that might be another group that would be tying it into some of the ideas that the libraries might. I mean, I know that you have that connection, but this is a specific committee within their group that's focused on that. And if you wanted, I could bring it back to them. There's a convention I'm not a librarian, but they let me in because I'm on the Friends group. And so, yeah, they're an exciting group and they might be highly motivated.
Thanks, Jerry. Kylie?
If we're making a list, make sure we don't forget the senior centers. I know Representative Griffith mentioned it like it's a given, and that's good. Let's just make sure it gets on the list. I know a retired attorney in the auto law section counsels at the Newark Senior Center on Medicare issues, and senior center members or visitors make appointments with her, and she helps them through their issues. And I don't know what training, if anything, she had to go through, but perhaps that model could be used after training on these concepts as well. Again, though, gotta be careful on, legal advice, but it could just be connecting people to the resources.
It's Lisa. Could I jump in there for a minute?
Yeah, absolutely. Go for it, Lisa.
So I was just sitting here thinking, I wonder if we would like to partner with our MCOs for some of this and leverage their resources, as well as be able to reach the population. What do you think of that idea?
I think it's a great idea. Jerry, MCO stands for Managed Care Organizations.
Oh, I'm sorry. I
That's
should have
okay.
talking in my state acronyms, started talking in my acronyms. I just think, they touch thousands and thousands of elder Delawareans, both, in facilities, but in the community. And then we help bridge them certainly from, someone who's in the community not receiving services to someone who could potentially receive services. And whatever sort of, mechanism we decide to go with here, I just think if we could pull maybe one representative from each MCO might be beneficial. And again, they bring resources to the table that we could piggyback on.
Thanks, Lisa. That's a great idea. Yeah. Kylie, I don't know if you have another comment or, okay. So, I had another idea, but I just lost it. So maybe it'll come back to me. But does anybody else have anything else that they want to talk about? It sounds like we're heading into, there needs to be a lot of outreach and more connections to the community that need to be made. We need to connect with individuals where they are instead of, giving them some information and expecting them to reach back out to us, especially us meaning the state. In terms of resources, we have to make a concerted effort, no matter if you're the state or another organization that works with people that are aging, to meet them where they are and provide resources to them there. And so it sounds like a lot of our recommendations that we've come up with today center around that, which I think has proven to work. Yeah, Jamie, go ahead.
So again, I know enough to just be a little dangerous in this area, but isn't there like a Medicare, for lack of a better word, consultant that folks on Medicare meet with during that open enrollment period where they have to pick what plan? And I know just like from my parents' perspective, it's like they pick the plan based on whatever medicine they have. And
yeah, the Department of Insurance does that. They do a really good job of that. I've actually utilized some for my mom.
Okay.
Yeah, it's very, very helpful. It's like Elder Info. It's through the Department of Insurance, and they provide, like you made an appointment. I made an appointment with them for my mom, and I participated in the call with her, and they kind of ran down all the plans and which was the best. They take a look at which medications you're on, and they refer, for the DPAP program, the prescription assistance program, and all those kinds of things. It was very, very helpful.
Right. So that just might be another point where, our population is meeting with them, right, annually. So that would.
I couldn't get an appointment, and I ended up going to a private insurance agent who's certified annually in providing that information. And I found him through Next Door Neighbor. That's how I found him. And it was a long, hard struggle. And I sent emails to that group and they never contacted me back. And so it was a dead wall for me.
Yeah, I know that in the Department of Insurance, it's the Delaware Medical Assistance Bureau, or Medicare Assistance Bureau, I'm sorry. And we partner with them. We do some social media outreach for them, but they have a very small staff, Jerry, and that could be why it was very difficult to get an appointment.
And I do think they have volunteers, that volunteer idea of mentoring or helping. I think they have a list of people. And so I expected that maybe I wouldn't have a paid staff person respond to my call, but I ended up finding a certified private agent. And so they are out there and they are available. And that person was helpful and did a meeting with me in their office. And I did have all of the information. I had the booklet. I went through everything that was online. I'm just sharing that. I mean, that's 3 years ago. So
yeah. I do think, though, that it's important to know that because there are people who will email or call, never hear back, and then never try to go out and see someone privately like you did. And so they're, they just don't know the information, and they could be making uninformed decisions that might not be helpful to them. We don't want that to happen. So Representative Griffith?
Thanks, Julie. I just want to say, Jerry, I'm sorry that happened to you. Now I feel like you're very connected with the state rep too. So, as the state rep here, if you or anyone find out that your friends are having trouble getting responses from state agencies, do know that that's one function of our job, is to really help connect our constituents with services, especially if they're not getting responses. Oftentimes, as you mentioned, it could have been somebody's busy or overstaffed, or the message got lost. Any number of things can happen. So sometimes
I'm starting to learn that. I have a road. I'm the new president of my civic association.
Oh, okay. Yeah, well, but that's just for everybody to know if they're having trouble getting response. And, often it's just a nice, it's a nice connection to make. And to be honest with you, I've met so many different people because a constituent called and said, oh, I haven't heard from this group. And, so we make the connections right away, and then I learn more too. So that's just a little helpful.
It's really good to emphasize, because I had never thought of representation that way, is what I'm trying to say. When Senator Gay has told me the different things she can do for me, I'm astounded. I would have never bothered her. And she's like, bother me.
That's my senator also. And I do know all of the senators, all the representatives have gotten the DSAPIT's Guide to Services. And if they need more, we're happy to give them out, because we have plenty. And we should be printing new one at some point in the near future. We're trying to get rid of the boxes that we have. So if anybody needs guides, just let me know, and I'll point you in the right direction for the Guide to Services. Which also, that was my other point, that we could be giving out guides to services to medical professionals as well, and make sure that they're available in people's offices, so they don't have to go online to get that information. They can just get it from the big book right in the office. So we could be doing a better job of that. And I do know that all of the libraries in the state have guides to services, and we just sent out a new batch to a bunch of the libraries in Sussex County. So whenever the libraries need them, they always reach out to us. So anybody have anything else? Could be a new recommendation that they want to discuss. It could be adding on. Anybody? I know Olga joined us, so if she has anything. Olga, we're discussing some recommendations that we could put forth from this subcommittee to the larger work group.
Sorry to have joined late. Yeah, I don't really have anything to add at this point.
Thank you, and no worries. Everyone is busy, we understand. Anybody? If you do have other ideas that you think of once this meeting is over, feel free to reach out to Representative Griffith and myself. So the plan of action going forward is that we will draft something. Representative Griffith has been taking lots of notes on this, and we'll draft something and send it out to the committee for all of you to review. And then once we get a finalized form, we'll meet one more time. We'll try to do that pretty quickly so that we can get in another meeting before the larger working group meets. Just to finalize the recommendations, and then we will send them up to the larger group to discuss. And they are meeting, I'm just looking at, I believe that they're meeting to finalize their recommendations on the 22nd of April. So we will want to do something before that. They're also meeting on the 8th to discuss it. So we'll want to try to get our recommendations formalized before April 8th. Which is pretty quick, I understand. Representative Griffith, do you want to schedule, get a date for another meeting before that?
That's what I was just looking at. It doesn't have to be, if we're able to by April, I don't know that if we're able to sort of have have our ideas kind of worked out via email by April 8th, I think we can update the group and then meet finally after that. Like, how would, is April 15th, what is Good Friday? Is that Good Friday?
Yep, that's Good Friday.
Okay. April 11th looks tough for me. I don't know if it works for anybody else. And I don't anticipate we need a long meeting. Like, we could have a shorter meeting. How would 9 o'clock? Would 9 o'clock work for everybody, or is that too early?
Unfortunately, I have a doctor's appointment.
Okay. How about, yeah, so I do too, but that's well, let's throw some days out there.
I can do any other time.
What about we meet April 8th, the morning of April 8th, which is Friday, at 10 to 11.
I believe that is when the Aging in Place, April 8th at 10, they are meeting.
Oh, I thought it was 1. Oh, they're meeting.
Oh, is it 1? Maybe
I could be wrong. No, I could be wrong. I have not gotten an update.
Michael, do you know if they're meeting in the morning or the afternoon?
We'll find that out. But
Yeah.
Plus April 8th. What time? Do they want to have the recommendations in by the 22nd?
I think Senator Mancivino said that they're finalized, that the larger group is finalizing them on the 22nd. Yeah.
So why don't we have a meeting the 18th and we can vote on our recommendations to forward to them? Is that good? Monday the 18th at 10 a.m. Does that work?
That works for me.
Yes.
Mike, could you please let Will Leskis know so that gets on the public calendar, and then he'll send out the notices? Does that work, Mike?
Yep, I can, and I can also reach out to him as well.
Okay, and then we'll have meeting minutes from the February meeting as well as this meeting to review and approve.
Great, okay, so I am just adding that to
April 8th meeting is at 1 o'clock.
Oh, it's at 1. See, I was wrong. So.
Oh, it's okay. Well, we figured out a time. We'll meet on the 18th. It's fine. We'll do everything else by email. I think we can do that.
I agree. Okay. Does anybody from the subcommittee have anything else to add before we move on to public comment? Yes, Kylie.
Is that going to be our last meeting?
Yes. That will be our last meeting, and then the Aging in Place, the larger work group, will come up with their final recommendations and report after the at the 22nd meeting. And hopefully our recommendations, which I think have been wonderful, will make that list, and I think they will. I have no poll though, so I can't. Okay, so are we ready to move on to public comment? Michael, do we have any public comments? I didn't hear if we did.
Mike, are you having difficulties, technical issues, Mike? Okay, I think I can do this. Let's see. If anyone would like to make public comment, please use the raise hand feature. Kylie, your hand is up. Do you mean it to be up? No, okay. Please use the raised hand feature of the Zoom format. Now I'm looking, it looks like everybody who is on the call is a panelist.
Agreed.
At the attendees, and it does not look like we have any attendees other than here. So I'm going to say that since there's no hands raised on our panelists, and we have no attendees, it looks like we have no public comment. So
if people are live streaming, they can email Caitlin Del Colo with their public comment if they have public comments. Right, that's correct. So, and I apologize again for my dog. So with that, I think we are closing out this meeting within an hour. So thank you all for your participation. Really appreciate it. I think we came up with some really great recommendations, and for the subcommittee, just look out for an email from Representative Griffith and myself related to the draft recommendations, and we would love to hear your comments once those are drafted. So hope you all have a wonderful day, and we will see you next time.
Bye.
Bye, everyone.